One more question, hot off the question list. Hello, everybody. Tina's just noticed you're all asking questions. That's cool because we are here at 6 o'clock on a Thursday. We're here to answer your questions. So that's really cool. We love it when we get loads of questions. And so do you guys because we get to help you. And today, with the Holistic Vet Sisters, there's myself, Caroline, Tina, Purple Dot Vet, and Marlene is with us again from Florida.
Yay!
We had so much fun last time with Marlene. And yeah, so really keen to have her back. So she's come back quite soon. I think you were with us a few weeks ago, weren't you?
Yeah, I want to make this a regular thing,
Yes.
once a month or so.
Brilliant, brilliant.
That.
So what should we do? Should we fire into the questions? Yeah?
Yeah,
Do you
do you
want
want to give a
to?
brief introduction again, Marlene, in case someone don't know?
And you like introduce myself?
Yeah, just a briefing.
Sure. So I am a practicing veterinarian for 40 years. Oh my gosh. And I've been doing integrative medicine for over 25. And what I would say I do is really called bioregulatory medicine because it's finding the root cause of the problem and fixing the root cause of the dis-ease. And that's my passion. I'm all about people, pets, and the planet. So I'm P to the power of three.
I
Mhm.
love that. So we have plenty of questions to get through today. So yeah, let's get started. We were discussing whether or not we already answered this one last week, but I said we didn't, so we're gonna talk about it today. Tina had a questions on the vaccine, so the DHP vaccine, the core vaccine that has distemper, hepatitis, and parvo. She's wondering because on the insert it states that you should only vaccinate healthy animals. Is there any guidance given to vets regarding this statement? I think that's an amazing question,
It
something
is
worth
an
discussing.
amazing question. And when we say, is there guidance? I would guess that 95, maybe 99% of veterinarians don't read the insert because their technicians open the packages and put them in the refrigerator and then they just go in and do their thing. But we all were taught that we vaccinate healthy animals. The whole point of a vaccination is to stimulate the immune system in such a way that when it does see that particular pathogen, it can mount a immune response or an inflammatory response faster and more efficiently. But a vaccine does not prevent you from getting ill. And that's a misconception that I think a lot of people have is they go, oh, well, I'm vaccinated, so I can't get that disease, or my pet's vaccinated, so it can't get that disease. That's not how the vaccination works. It's actually trying to educate the immune system to respond to a particular pathogen when it sees it. So the reason why you want to have a healthy animal go through that is because if the immune system is distracted or hijacked and fighting something else, it only has so much bandwidth and it can't respond to the normal wear and tear of life. And then you add another stimulus on top, which says, oh, and by the way, let's have you work a little harder. And now I want you to respond to this toxin while you're trying to respond to all those other things. So that's why it makes sense that you want to vaccinate a healthy animal so you're educating and stimulating the immune system. I think at this point, it really is going to take the educated pet parent. That's why I teach a course called the Empowered Pet Parent, because we, the pet parents, are the guardians. We have to be the one that is empowered and responsible for the wellness of our pet. That doesn't mean you have to be a vet, but it does mean that you have to use some critical thinking and have some level of education, meaning what does health look like? What defines that? So I think it's going to take the pet parents themselves to say, no, please look at your insert. Don't make me vaccinate my animal when my animal is sick. And I hear these horrible stories about people that have a dog with an ear infection or it's vomiting or whatever. And the vet looks up or the receptionist looks it up and says, oh, well, your animal's overdue. Doctor's going to vaccinate them because they're overdue for whatever, and then we'll see your pet. No, do not allow that. And do not be shy to say, I'm going to take my business elsewhere because you are not performing in the highest and best interests of my pet. And then go find somebody who's more like minded. You are not going to put a round peg in a square hole. So if they aren't aligning to the health principles that you are learning from this show and many others, then it's time to find a different advocate for your pet.
Yeah, I wrote about this in my book, actually. Just the definition of what is a healthy animal, I think, is what we need to be considering there. And
Good.
our perception, the way we see things more holistically, we might perceive an animal not to be as healthy as a vet who works traditionally or allopathically might do. So I think that there is an awful lot of pets that are being vaccinated, which potentially have internal gut dysbiosis that hasn't yet evolved into an external symptom. So we think, oh, yes, my animal's fine. That old word, he's fine, he's fine on the food, he's fine. And actually, internally, they're not. So then to add the addition of a vaccine isn't something that we would want to be doing. And I think it's not seeing an external symptom, this understanding of what could be going on inside, it just goes so deeper. Is any animal actually ever at the what we call a healthy state to take in something like a vaccine? Because they're correlated with inflammation, and we don't just mean at the site that the vaccine went in, that bit's quite obvious, but anything itis that's going on with your dog means that they're not in a completely healthy state. And so many dogs over the age of 6 or 7 start to develop things with itis on the end, whether that's pancreatitis, arthritis, whatever that might be. And so, really, should we be vaccinating those dogs? I don't know that we should, really. And yet it continues and it continues.
Yeah, I think this is
go ahead.
Yeah, no, I just think this is a very actually quite controversial topic because I think it depends on the individual vet and what they think. Because actually I just looked through the guidelines, the vaccination guidelines again, and it does say do not vaccinate ill animals, but then it also states that if the animal has allergies or something, but it's under control, so the animal appears healthy, then vaccination is okay. But then I see in practice, for example, I live in Norway. We don't even have these diseases. Like we don't have hepatitis, we don't have distemper, but we still vaccinate for them. And we have a little bit of parvo, but like I think I've seen it once. It's in Sweden. It's it's like you barely ever see it, and it's mostly in puppies. And then it's like we're doing this risk when the risk of actually getting the disease is smaller. So in the end, I think it's also depending on where you live. Is it a lot of disease pressure? Is the risk of getting this disease actually very high? And then can you titer test? Titer test.
Yeah, those are all great points. And I think the other thing that we really should help pet parents to understand is what truly defines that underlying low-grade itis. And that could be the eyes getting cloudy, the lenticular sclerosis. So when you look in your pet's eye and it looks a little more blue, not a full cataract, not the traditional cataract, but this is lenticular sclerosis where it's becoming denser. That is a form of inflammation. Periodontal disease, any gingivitis or tartar on the teeth, it's another indication that there's some low-grade inflammation. And then, of course, any skin problems or toenail problems or wax in the ear. They don't have normal wax in the ear. It's an indication of overproduction because there's some irritant going on. So I think there's a lot more subtle signs that we need to pay attention to. Any coughing, sneezing, eye discharge, nasal discharge, vomiting, diarrhea, and it doesn't have to be chronic and insidious going on. It could be, do they have episodes? Here's a great one. We see a lot of animals that have a grumbly tummy for a day or so of the month, and they go off their feed and they don't want to eat, and you can hear the noise in the tummy. That is a huge indication of gastric reflux. And so that animal is having a problem, a picky appetite. That's my very first question. What kind of an appetite do they have? Do they eat like the lion out in the wild where they're just ravenous and there's blood and saliva going everywhere? Or do they kind of walk over to the bowl, they look at it and they go, oh, a bite, I don't feel like eating anymore. That is not a normal appetite. So I think there's a lot more subtle things that we can educate pet parents as to finding those early indicators that something isn't quite right. I'll give an example of myself. We had a really awesome weekend with a lot of activity. And so I got some inflammation in my fingers, and you wouldn't look at me to see that, but when I would close my hands, they would like, trigger finger, and they were a little stiff. And so I took some, it's a modified citrus pectin, and I made a tea of it this morning, and it was immediately resolved. So I just had a little bit of low-grade inflammation. Again, nobody would have noticed that. You couldn't see a change in my activity or my behavior, but I could feel it in my joints. So let's not underestimate what these animals are going through. It's any change in behavior where they're slowing down. We don't age that way. Right? That's not a normal aging, that you get older and you slow down. No. So when you see those changes in behavior, appetite, activity level, interest, those are all indicators that that animal, there's something off.
And
Just
the
wanted to
irony is they probably were healthy before their first vaccination.
Maybe. Well, just think about what happens to them just
Yeah.
from birth through the breeder, right? Because you're not getting them as a newborn, you're getting them, they're already average 8 weeks old. So what happened before you got them? What were they exposed to in that other person's house?
I just want to clarify. You said that when a dog, for example, doesn't want to eat, it could be something wrong. I just wanted to clarify cats and dogs that are very picky. Is that what you're talking about, or just the ones that
No.
change behavior?
Both. Both. I have people that say, oh, my dog's always been a picky eater. Well, they've always had leaky gut. It's
Something.
as far
That's
back as you can
something.
remember, they have not had a healthy gut. Because if you think about the biological terms, what would a healthy animal in the wild look like? If it didn't feel good and it didn't feel good enough to go out and hunt because its tummy was a little bit on the rumbly, or they were a picky eater, you're going to die of starvation because you don't have the motivation to go out there and hunt something, kill it, chase it, kill it, and then eat it quickly before somebody else eats you. So these are behaviors that are designed to help that animal survive and pass their gene pool on. Because we've domesticated these animals and we're feeding them, they don't have to work for their food. We have forgotten that their instinct to eat hasn't changed, or it shouldn't have changed. And if it did, it's because they don't feel good.
Mm. Mm.
Should we go on? There was a question in the comments here actually from Alicia. Now that we're on like the vaccine topics.
Okay.
Alicia is asking, I'm taking my 1-year-old dog to the vet in a couple of weeks for her first titer test and a yearly health check. To be proactive in a dog's health care, are there any tests that are good that a vet should do every year, or that we should ask our vets to carry out that they might not automatically do, for like, for example, blood tests? And if they should do, like, should they add endocrine and electrolytes, urine analysis, or anything related to dental health?
What a great question.
Oh, can I go? Can I go?
Yeah, go. Go.
So I think all of our fur babies should be tested for baseline CBC chemistry, thyroid, and urinalysis, somewhere around a year of age, maybe a year and a half, or when they get their, if they're spayed and neutered at an earlier age, 6 months to a year, you should always have that as a baseline. And then I start looking at their lifestyle. Are they eating a kibble diet? Are they showing any indications of being a picky appetite? Those are animals I want to test for nutrient deficiencies. And so nutrient deficiency would look like vitamin D, magnesium, B12. 85% of dogs eating a kibble diet were shown in a university study to be deficient in vitamin D. Such an important nutrient that we have to have in our body, and it functions in the innate immune system and so many metabolic functions. And magnesium the same way. We know people are notorious for being magnesium deficient. Well, the same thing is happening for our pets. So I think testing for nutrient deficiencies on any animal at even a year of age that is showing any indication of an abnormality should be tested for nutrient deficiencies. And then the next thing I like to test for are mycotoxins, are particularly in areas where mold is a concern, or if they've been eating a kibble diet, because a lot of these processed grains, the way they're stored, they grow mold on them. And then that's processed, and then you get these toxic products, which are called the mycotoxins. And we have 5 different categories that I test for. Very few veterinarians test for mycotoxins. And it's a shame because there's not really a specific disease or symptom that you would know. But when you start seeing things that are just adding up and they're not quite right, and you live in an area or you feed a diet where mold can be a possibility, then I think that's an important test. I love testing for microplastics. We talked about that on the last show I was on, how important that is. And the studies that we have back now, I don't think we had any back at the time I was with you. We're finding the average person, they say, has 21 particles of plastic in their blood. They either get it airborne, ingestion, or intravenously. The animals, are we sitting? Average high 30s to the 40s is
Wow.
the average I'm seeing in these animals. So double the amount of plastics in these animals than we're seeing in humans. And a majority of it's coming inhalation and through ingestion.
That's a lot.
Yeah,
Mm.
it's a lot. I also like to test for osteoarthritis, particularly on the breeds where it is prevalent. And I'll start testing some of my medium and large breed dogs as early as a year of age because I want to see what's happening, want to see if they're actually breaking down those cells in the joint as an indication that they're going to have some extended problems down the road. And then I like testing for glyphosate. Unless you're in a part of the world where it's banned and you don't have any, we have it coming down in our rainwater. It's everywhere. And now that Bayer bought Monsanto, they changed from glyphosate, the product, to 4 chemicals that are even worse than glyphosate. It sells under the name of Liberty. So anybody who is spraying these herbicides and pesticides, we really need to test for that as well. What
I
else?
What
Go ahead.
about heavy metals, Marlene? Do
Oh,
you do heavy
absolutely.
metals? Yeah,
Yeah.
I mean,
If an
I think
animal,
here, especially in the UK, it's a good
yes.
idea.
It's a big problem, and it's in our drinking water. So
Yeah.
if an animal is drinking tap water or eating a processed diet, all of those animals are tested for
Mm.
plastics and for heavy metals. And they're high. I just tested mine and I was off the charts for strontium. And I
Wow.
don't have any, I didn't think I had any exposure. Now that could have been an exposure I had a long time ago, but I'm actively detoxifying that. So
Yeah.
once we know that there's a problem, then absolutely we can take measures. I'll use plastic as an example. Once people became aware, and this was a human study, once they became aware of where those plastics were coming in through their lifestyle, maybe they were using a plastic cutting board, they had carpeting in the house, they had all polyester clothing, they had air ducts weren't clean, they were storing food in plastic containers, and they were drinking out of plastic water bottles. When they changed their lifestyles within 90 days, they were able to significantly reduce the amount of microplastics that were in their bloodstream. So we can do the same thing for pets. We just have to be changing our lifestyle. We have to be making choices that I don't think are harder because I live that life. So for me, it's not harder. It's just what I do. And as you do that, it starts to become just who you are. And it's not harder. It's actually a lot more joy and gratitude, and you feel better because you're just more connected with what health really comes from.
Yeah, I think that's so key. I just want to say as well for all these, because there's a long list now. There's a long list that Alicia's got to write down. These are not all blood tests, so it's not going to be loads of blood. A lot of them can be urine-based metabolite testing,
Yes.
but some of them you
Yeah.
may have to find that your dog is giving blood, or you may need urine from different days for different tests. And yeah, so
Yeah, that's a good point. Thank you.
I
Yeah.
could just
So
imagine her worrying. The dog's not going to have any blood left.
yeah, no, the usual thing that most Western practices do is that, you come in when they're puppies, they get one, two, maybe three jabs, and then you see them again in the year, they get a new vaccine, and you just do a quick health check. You look at their teeth and their body condition score, and you have a quick chat. Most practices in Western practice, we have like, what, 15 minutes to do all of that, give a vaccine, look at the dog. You don't really have time for a lot of those things. So that's why I'm very into integrated medicine, because they set off enough time to talk about these things, because that's the most important thing you do in a consult, but there's no time for it. So yeah, on average, there's not a lot of tests that they do frequently or recommend. I think doing senior blood testing is more common in Western practice, that they recommend that when they get older, maybe pre-op bloods if they're going into anesthesia, or when they're becoming seniors, they recommend to do maybe yearly blood testing. But otherwise, there's not much they recommend in general.
So the whole idea of getting that senior blood work, the CBC chemistry, thyroid, and urinalysis, is that gives you a baseline. Those numbers do not change dramatically through that animal's lifetime. So if you know what normal is at a time when I would hope they were as relatively healthy as possible, so that could be 6 months to a year, then that becomes your baseline that you're going to use for the rest of their life. Now, the value of that blood work is in the absolute differences. So if an animal's normal white blood cell count, say, is 6,000, and they come in one day and it's 18,000, well, in our reference lab, the range is from 5,000 to 18,000. So a lot of younger practitioners, they're going to go, oh, it's in the normal range. But if you know that animal was really 6,000 and it's now 18,000, that's 3 times normal. Something's going on in there. So I think that's a really important thing for pet parents to ask for. It may not be recommended. Sometimes veterinarians have a tendency to assume that somebody doesn't want to do something because it's going to be a cost. And I think that is one of the greatest disservices that we in the veterinary industry can do, is to assume what somebody will or will not do and characterize them based on the way they dress or the way they talk or where they live. We need to educate. We as veterinarians, our job is to provide the best education possible so that our pet parents can make an educated decision that fits best with their lifestyle, their financial budget, their belief systems. But our job is to educate. I'd like to go back and make one comment about vaccines, if I may, and that is the timing. In the traditional veterinary model, the vaccine companies had come up with a schedule to vaccinate at 6, 8, 12, 16 weeks of age, usually like every few weeks. And the reason they did that was because it was too costly to try and test when the maternal antibodies, the colostrum and the antibodies that puppies and kittens would get from their mother, when that was leaving and the vaccine was actually going to be able to enter and do its job. Maternal antibodies block the vaccines from actually doing anything. So these vaccine companies came up with this model where they vaccinate every 2 to 3 weeks until the animal is 16 weeks of age. And that their reasoning was somewhere along the line, the maternal antibodies are going to drop and the vaccine can then step in and stimulate the immune system. And hopefully there would be at least 2 vaccines over the age of 14 weeks where all those animals will now have this stimulated immunity. The problem with that is the vaccines are not innocuous. And so in my practice, I don't vaccinate until they're 14 weeks of age. And that's dogs and cats, if I have a choice. Now, many times they're coming from breeders where they're already given a vaccine at 6 or 8 weeks of age before they're sold, because there's these laws in place that say they have to have these. But I'll actually call my pet parents and say, if you can ask the breeder, you'll sign a waiver, you'll sign an exemption. Don't get them vaccinated that young. And for rabies, I wait till they're 6 months. So there are counties that are vaccinating at literally 12 weeks of age. That poor little animal, it's like giving a baby a hepatitis B vaccine at birth. It's not warranted. Now, I do tell those pet parents, if they're going to wait on the vaccines, work on good gut health, work on good immunity, get the good diet down, get the exercise in, do your training, and don't go to dog parks. Don't go to places where they're going to be exposed to a lot of dis-ease or stressors. They're babies. Let their immunity build and develop normally.
Yeah, very well said. I think I just wanted to add, because I live in Norway, so I think is a bit different everywhere. What kind of tests are always available to you? So I want to add on to what Dr. Marlene said. A lot of those tests are not available here. Some things that I do recommend if people want to be proactive is a hair mineral analysis. That's very easy. Hair tissue don't really die, so you can send it off. It might take a little bit longer, but that in that way you can see things like heavy metals, early so that you can stop it before it actually becomes a problem. And I'm also a big fan of microbiome testing because then you can pick up things maybe before it starts to become an issue. So yeah, those are the things I normally recommend to kind of be proactive and get ahead of the disease.
Yeah, yeah,
Absolutely.
absolutely. They're very easy to do here as well, those two. And I'm sure that the thyroid would be as well over here.
Yeah, one of the things that we're seeing when we're doing mineral analysis is that there's a massive suppression to the absorption of a lot of these minerals. And that could be a mycotoxin problem because it's causing this massive inhibition. But when you see a lot of numbers that are below the mean or absolutely low, you know that something is causing it. Either they're not absorbing their nutrients or the nutrients aren't in the food. Maybe they're synthetic, or for whatever reason, there's inflammation going on, or you're getting chelation because things aren't in balance. So it isn't just about, oh, let me give my dog vitamin E and magnesium and zinc. It's about ratios and balances that are very important because if you get too much of one thing, it can cause suppression on something else. So those are also really important principles to be thinking about. We don't want to be putting these animals out of balance. So testing, not guessing, and then feeding a well-balanced diet, always safe doing the essential nutrients, the essential vitamins, minerals, fatty acids, and amino acids. Always safe to do that because that the body has to have those. And those are definitely deficient in the food that we're being given to our pets in today's modern age.
Mhm.
Mm. Are you guys up for a bit of a controversial one?
Oh, yes.
Yeah, because Claudia is asking an excellent question here, which I honestly asked early on. So Claudia said that I was a new puppy mom 7 years ago. I was confused on what to do. I didn't want to vaccinate them, but also didn't want to risk them getting the diseases. I was a newbie to all these things and raw and holistic health. And my question to the vet was, why does a Chihuahua get the same dose of vaccine as a Great Dane puppy? I asked if they could give half the dose, but the vet wouldn't. They only got the job at 10 weeks. So yeah, I think that's an excellent question and also slightly controversial because there actually have been titer testing done on this, and they're also asking the question, even it was in the Vet Times in the UK, like, why are small dogs getting more vaccine reaction than big dogs?
Yeah.
I wonder why. And there was
Yeah.
actually done on this as well, doing titer testing on small animals versus big animals. And usually there was a much higher immune response in the small animals than it was in the big ones. In the biggest dogs, the vaccines were barely efficient. And we always have this like 1 milliliter vial for all sizes, Chihuahua puppy and an adult Great Dane.
Yeah.
It's the same dose.
Yeah. The way the drug manufacturers created the vaccine, that's the way they created their label. And I don't know that I have an adequate answer as to should you give partial, should it be based on body weight? I think there's a lot of variables in there, and I don't know that I have a great answer for that, other than I would wait till there's a more stable immune system, and then I would do my minimum vaccine, and then I would do titers after that. And that way you're getting a better feel for, is this animal truly responding? But I also would say, don't sit there and make your line in the sand about how much vaccine they're getting volume wise if you're still feeding kibble, if you're still using a lot of pesticides, if we got to be thinking about the whole picture. What kind of lifestyle overall are you creating for this animal? Does that make sense?
Mm.
Mm.
I just think there's not enough really in terms of looking into this kind of thing because even with the dietary recommendations, it's only fairly recently, really, that they've added in the different metabolism for a smaller dog. So I think even this kind of thing, that to us is kind of a bit obvious, but they haven't really done that from the beginning. So there's just a heck of a lot that isn't really researched optimally with animals, I think. And whether it even is with us is another question, but it certainly isn't with animals, with pets.
Yeah, so I guess that is the thing for us vets too. It's difficult because the guidelines, like what is given to us is that this is the vaccine, it goes for everyone. The same, doesn't matter what size, it's the same for everyone. And obviously it's created so that the biggest dog possible will get a benefit from this vaccine. Even though, humans or animals are different in that sense, especially with dogs, we have so many different breeds and they're also different in size. So yeah, so the guidelines that we're all following is the one vaccine per dog, and by law, that's kind of what we need to do. If someone does want to read further into this, there is people actually doing a bit of studies on this. If you go to protectthepets.com, they've done some studies on titer testing on the vaccines, on the comparison of different sizes of dogs, and then they actually have their own recommendation of how much to give per kilo dog. But again, this is not the national guidelines that we are following, so that's just something to read into. But yeah, I think the science definitely need to catch up on this. So yeah, that's an excellent question.
So are they finding that the immunity is based on the volume or on the individual response?
I didn't quite understand the question.
So we have 1 cc of vaccine. The volume is 1 cc. The studies, are they showing that it's the volume that you give based on body weight that makes a difference? Or is it just that you're going to get an immune response from the product and it's not volume related? And I don't know the answer.
Yeah, I'm not sure if that's specified, but I do know that it showed that the bigger the dose, the bigger the immune response. But obviously, potatoes,
I think
potatoes.
it sounds
Still,
like they're looking at antibodies, so they're going to be looking at immune
yeah.
response, maybe rather than looking at did the adjuvants hurt the Chihuahua more than the adjuvants hurt the Great Dane, kind of thing.
It's like, I guess in the end, that's what the issue is, isn't it? That the adjuvants,
Mm,
there's quite a lot of aluminium into a little Chihuahua if they get a vaccine every year compared to a massive Great Dane, for example.
mm.
Yeah, it's toxic no matter what, but there
Yeah.
are cleaner vaccines that people can ask for. Again, it's about being an educated pet parent. In today's world, there's so much noise and there's so many choices, and there's not all things are for our highest and best good. Like walk through the grocery store in any country, and you're going to see all kinds of horrible ingredients and additives and preservatives. And so we can't just sit back and go, oh, somebody else is going to think for us. We really need to come back to that critical thinking and choose for ourselves what kind of lifestyle do we want? What kind of things are we putting in and on our bodies, our pets' bodies, in our households? What kind of lifestyle do we want to live? And then we have to make those choices. We have to decide for ourselves what we want to do to ourselves. I know in particular, I'm very, very conscientious. And so I will use silicone and steel and glass before I will use anything in plastic.
Mhm.
Hmm, exactly. Yeah, also, maybe we can mention a bit because this is also in the same subject about non-responders, vaccine non-responders. So Claudia is also asking because I did a titer test where they were 1 year old and one came back positive for everything, and then one came back. No, one came as positive for just one of the diseases. The other pup was negative, and my vets recommended revaccinated, and I said no to that. So I guess obviously it's a difference depending on when they got their last vaccine, because obviously a lot of the pets
Mm.
that get the vaccine before 16 years old do
We,
test negative on the titer test when they're older because they still had maternal antibodies. But again, say that, they gotten vaccinated at 1 year old and then they get vaccinated 3 years later. Dr. Marlene, what would you do to a non-responder, or would you
I
revaccinate
don't think that is a non-responder. That doesn't sound like a
the 1 year old?
non-responder.
Yeah.
That's just a dog that didn't have any antibodies floating around in their bloodstream. It doesn't mean they don't even have immunity. It just means they don't have any antibodies floating around. So they're not in fight, which really
Yeah,
is better.
that is a really interesting question, the way they put it, because
Hmm.
In actuality, and I'm not an expert in this area, but in actuality, having antibodies does not equate to your ability to have immunity. So even though we use that term, oh, I'm going to do an antibody titer, and if they have good titers, then that's going to act like they're protected. But it really doesn't. In the true immunological sense, they don't mean the same thing. But that's what we use.
Mm.
It gets very technical, but yeah.
I would say a non-responder is you'd have to do the blood test pretty soon after the maternal antibodies, so if they're not in the way, you'd have to give the vaccine, do the test, no response. Give the vaccine, do the test, no response. Surely at least twice to double check that they're not responding. But that
Yeah.
again is only a test of response via antibodies.
Yeah,
Mhm.
sorry, so not to confuse
Doesn't,
here, but
yeah,
so
it
if
doesn't
obviously if they're
exactly
young,
equate.
yeah, if they're younger and they don't have antibodies, then I would vaccinate again and then check again. But say that we ha do have a non-responder, like let's say they got the vaccine at 1 year old, and then 3 years later they test and they don't have it. Then would you then give the vaccine again and then titer test again? I assume.
Technically, in the model that we're using now, the answer would be yes. We have a 3-year distemper vaccine. So we don't even have to do anything for 3 years because the label says that they have immunity for 3 years. We're using antibodies as a indicator of when to revaccinate, but in the true sense, that isn't the end all be all answer. But
I
that's
agree.
what we use for right now.
I think also we are so used to being scared of these diseases, and we don't realize just how inflammatory these vaccines can be internally and what that can set up to happen sort of years down the line, even. So
Yeah,
we're sort of fearingly hoping that we're setting the dog up to not suffer, whereas actually we're creating chronic suffering, really. And every dog will be different because every dog will have a different way of reacting and responding to the adjuvants. They'll have a different way of responding to the sort of forced recognition of something that the vaccine does with the immune system, and whether that then creates problems. Every dog's liver will be slightly different, so the detox pathways will be different. So you're never going to see the same ailments in each dog. And it's like everything really is so different. All animals' bodies are so different. The prediction of things and wanting certainty is something that we're all having to come to terms with, isn't it? Even emotionally and spiritually, we're having to come to terms with the fact that life isn't certain. And then unpicking that, unraveling that, and going, whoa, hang on, I thought everything was quite certain and we had the answers, but we don't really. We don't. So
yeah,
this is all part of growth. And I think sometimes dogs almost find us in our lifetime to help support us find that fact out, that uncertainty is going to happen, and trust needs to be built within us.
yeah. We have this amazing immune system for a reason. And I think it's been very many years that we have been lulled into thinking that vaccines actually prevent these diseases. And I alluded to that earlier in the conversation, saying that vaccines don't prevent you from getting a disease. They are supposed to stimulate your immune system so you have a faster, quicker reaction when it sees it. But when you go back to on the human studies where we had diseases like measles and we had smallpox and a lot of these other diseases, when you go back and look at the studies, by the time the vaccine entered the picture, herd immunity had already been where a lot of people got sick, you reached a plateau, and then the number of new cases had already dropped almost to the baseline. The vaccine is then introduced, and people were led to believe that it was the vaccine that made this disease go away. It's actually not what happened. So I think what all of us have been saying is that we have laws that dictate we should be doing this. We know pharmaceutical companies are very big and very powerful. Are they really necessary at the rate that we're being told? Probably not. And I'm not an anti-vaxxer per se. I am anti not good science. I am anti harming with a product. So I think we need to be putting a lot more focus and intention with our pet parents on feeding a species appropriate, healthy diet, helping the organs of elimination work properly, minimizing the amount of toxins that our poor animals are exposed to, supporting them in a way where their bodies do what they naturally and innately know how to do. That's where we need to put our focus, not saying I'm going to live this toxic lifestyle and I'm going to go to the doctor and get better, or I'm going to get a vaccine and it's all going to go away. No, that's how we got into trouble. So, irregardless of pro-vaccine, not pro-vaccine, the conversation really needs to come back to, are you feeding a species appropriate diet? Are you leading as minimal of a toxic lifestyle as you can? And that includes electromagnetic frequency exposure and hormones, chemicals, pesticides, herbicides, things that we can't measure, glyphosate in the rain. We have to look at our entire lifestyle. Are we doing good air scrubbers in our homes? Because now that we have homes that are so sealed off, we're having a lot more toxicity. Now the off-gassing of fire retardants and the plastics that are in carpeting and our synthetic clothing and the things that we're cooking with and the the nonstick surfaces and all of these gases that we're creating, they have nowhere to go. And so what do we do differently? We start looking at how do we clean our houses more sustainably? How do we clean the air more sustainably? How do we have more sustainable food and water and things that we put on our skin? That's really where the focus needs to turn to. We're dissecting down to a piece of the problem, but we're not looking at the global picture.
And I think because some of the other questions that we had that we mentioned before, when we're talking about the gut dysbiosis, when we're talking about dogs that are anxious because of this and have microbiome changes because of this, ultimately, in the holistic framework, you're coming back to the same things for each issue. There are sometimes going to be specific remedies that you might use. So if you were as a herbal vet, you might use specific things. If you're homeopathic, you might choose one that's either for the dog or for the ailment. But that, so that you're going to have that within the holistic way of thinking. But what Marlene is explaining it is so vital no matter what is going on for your dog.
Yeah. Yeah.
Should we go on with some of the questions from today? There was an interesting one here that I was excited for Marlene to talk about. So Christine asked a question. She has an 8-year-old Jack Russell that has been fed raw always. He gets plenty of raw meaty bone, no starches. She brushes teeth daily and adds seaweed to the food every day. He had 3 dentals so far. He's 8 years old, just staining in a bit of tartar, but enough to really bother her. So is her animal weak? Is that a thing? Could this be the reason that this happens?
So I hear a raw diet, but that doesn't tell me, is it a balance of meat, fat, bone, and organ meat? And are the essential nutrients being supplemented? Because a raw diet, very broad. People tell me, oh, I feed a raw diet, and they're feeding 100% meat and fat, but there's no bone in there. And I heard her say that I give a bone, like in a big bone that the animal's chewing on. They're not getting a ton of calcium out of that. So the calcium phosphorus ratio may be off. I don't know how much fat is to the meat and what kind of insoluble fiber are they getting? And is she supplementing with the essential nutrients? There's a lot of gaps in there, so it's hard to answer that question. And then what else is she doing in her environment and lifestyle? What kind of water is she utilizing? Is it tap water? What part of the world does she live in? Because there's places where that's going to be worse than others. And What are the things that she's using topically on that animal? What does she clean her house with? What are the bowls that she's feeding out of? There's so many pieces. It's not about one thing. It's about looking at the global picture. So if the animal's eating a raw diet, let's get more definition on that. Does that make more sense?
I'd quite like, I know we can't really hear, but I'd quite like to see a photo of this tartar because sometimes it's like we're just obsessed that we want something to be as good as it can be. And actually, it's all
Really
right.
white.
It's like we don't need to worry really. That's better
And
than
is it grass fed, grass
90% of
finished?
dogs.
Right. I mean, there's so many different pieces. When I started my raw food company, there were literally three companies doing raw food. One was using non-organic meats. The other one had synthetic vitamins and minerals. And I went to them and I said, would you make a diet? And here's the specifications I needed. And they said no. They didn't think people would buy it and they didn't want to change their production and they were going for fast, cheap, and convenient. And now we see a gazillion raw companies out there, and they're stuffing a lot of these diets with peas and corns and carrots and broccoli and kale. And it sounds wonderful for an omnivore, not so much for the herbivore. And those vegetables may or may not be organic. And do they actually have the nutrients in them that we're expecting them to have? Where were they grown? What kind of soil was it? What was sprayed on them? There's just a lot of questions. So I would say to the person asking the question, let's get more clarity on what you are actually feeding. And is it truly a balanced raw diet with the essential nutrients provided as well?
And are they
Hmm.
stripping raw meaty bones? Because we mentioned chewing, but sometimes it's the stripping of things that is like the toothbrush. So that a lot of dogs don't strip raw meaty bones. So it might be useful to know that bit more as well.
Mm. Yeah, the only thing I think I'd add, saying that, everything is perfect, the diet is perfect, everything in the environment is perfect. Sometimes there are specific bacteria as well that can make them more prone to getting tartar. So,
Mhm.
Pet Biome, I sent out a newsletter not too long ago, for a microbiome testing, and they're actually also doing oral microbiome testing. And then they can check out what bacteria exist in their mouth and how you can potentially change their diet. Depending on what bacteria you want to feed to have a better oral microbiome as well.
The mouth is an extension of the gut. So yeah, you can have an unbalanced biome even if you're doing everything you think's right, just because of the environment, you know?
Mhm.
And Michelle was asking a follow-up question as well for Dr. Marlene. So you touched on grounding last time. Could you explain it a bit more, please? And any recommendation for quality grounding mats or sheets for both dogs and humans?
Oh yeah.
The best one is earth. Go outside. Go barefoot, go to
Yeah.
the beach. We just went kayaking this past weekend and literally just your feet in the sand and in the dirt and be outside, plant a garden if you can. I mean, that's truly the essence of grounding is start to go back and be in nature, touch your plants, hug your trees, get your hands in dirt, pull some weeds. If you don't have a garden, then go to somebody that you know that does have one. Just pulling a weed exposes you to trillions of microorganisms that your body needs. So that's the best grounding to do is get outside. And then I don't have a particular company for grounding. I've tried a lot of them and you got the things that you lay on your bed and things that you put your feet on at your desk. I think at the end of the day, let's not forget we're on planet Earth for a reason and go outside. Even
Mm.
if you have to set your timer for once an hour, we can all walk out of our offices and take your shoes off and just stand in the grass for 5 minutes. Take some deep belly breaths, be present. I like box breathing. You breathe into the count of four, hold for the count of four, out to the count of four, and then hold to the count of four, something like that. And breathing, being in nature, being present, and then think of three things that you're grateful for. You have just rocked your world.
I just also want to say as well, if the ground is even slightly damp, you're going to ground better. You will earth better. So if you're on really, really dry ground that's cracked and what have you, you're not going to earth as well as if it's got moisture within it. because the water is part of the process, that moisture as well. But dogs generally will go and grow. I mean, Fusa loves the flower bed. She'll be straight out in the flower bed rather than the patio, if you see what I mean. They
Yeah.
know, they know these animals. Watch Grounded the movie, Michelle. You will love it. Grounded the movie. You get to see a baby moose, and he finds the grounding mat that they've put in for him amongst the straw. It's the cutest thing. He doesn't see it, but he knows where it is. He can sense it.
Yeah.
And stay away from the grass that are sprayed with glyphosate, of
Oh
course.
my God, yes.
Yeah. Without having to reiterate that, absolutely, yes.
Yeah. Oh God, that's so hard if you're in the city. Very often it all is. You
Hard.
can get grounding shoes. They're not cheap, but they've got like little round things in, haven't they? That for you, not for the dog, but
Yeah.
yeah.
Have you tried them?
Find places that are near you that you can go, whether it's the beach or a park or a river or a stream, or,
Yeah.
just scope out those places and make it a point to go there.
Oh, I tell you what, I've got them out as well. I've got my grounding. So my grounding jingamy jing jings. So what you do, I'm not saying everybody get one of these, but you dong it, and this is the grounding, the earth.
The frequency of the
Dong
earth.
it,
Yeah.
and then you get it on your foot on kidney one. Oh my goodness.
Point.
And you put it there and you ground yourself.
Love
Do
it.
it now while I'm talking to you.
What do you do then? Do you hit the
Yeah, you
thing?
just make this tuning fork
A
vibrate.
tuning fork.
Yeah, it's a tuning fork. And then I just put it on the bottom of my foot. Yeah.
I love
You
that.
can listen to it if you want. It's very calming. It's the resonance of Earth,
And
planet Earth.
527 or 525, 527?
Well, 528 is the Hertz
528.
on
Okay, yeah.
solfeggio frequencies, but I'm not sure that that's what this is. I will look it up again. I thought it was seven something actually, but I will look it up.
I love
And
that.
can I go back to something that you talked about earlier, Dr. Marlene? Uh,
Absolutely.
you were mentioning that picky pets or pets that are picky eaters can have an imbalance. Now I'm sure there's 10 people sitting on here, but my dog or cat is very picky and they don't eat. Does that mean that they're ill? So my first question is, does this go for cats as well? Because there's so many picky cats out there. And
100%.
yeah, and secondly, what should these people test for?
Well, I have a free ebook. This is going to be, please, everybody enjoy, download it because it gives you my 6 steps. Step one is really evaluating all the things in your lifestyle that are contributing to the problem: food, water, air quality, what's touching the skin, environment, your thoughts, the EMF, all of that. You really evaluate that. And then the testing I would do would be looking for deficiencies and toxicities. So all those same tests that we were talking about, something in there is off. And it's usually a combination. So testing for the magnesium, vitamin D, B12, your micronutrients, your heavy metals, the microplastics, the mycotoxins, all of and glyphosate. Those are the real basic ones that I look for. And then you're evaluating what the animal is actually eating. Then you also use some of the blood work and bioenergetic scans to see what's the homeostasis in that animal's body. Is the lymphatics congested? Because we can talk about lymphatics, but think about the two most important organs of detoxification are the liver and the lymph. And we don't have a great test for the lymph. However, we know that anytime you've had a surgical procedure, you're cutting through these lymph passages. And when you don't have physical activity, high intensity exercise, your lymph is going to get sluggish. It's just by nature of what it is, because movement is what pushes the lymph. It's the muscle contraction since it doesn't have a pump of its own. So if you have a pet that is indoors and the most you do is walk around the yard or walk around the neighborhood a couple times a day, and you're not getting that high intensity exercise, that animal is going to have lymphatic stagnation. End of story. So that is a contributing factor. It's not one thing. It's this multitude of lifestyle events that are leading to the culmination of an animal that is not thriving. These animals are surviving, which means they're hanging in there, they're not dead. And a lot of people think, oh, well, my animal's up, it's walking around, it eats a lot of the time. And, just because it doesn't some of the time, it seems to be okay. But that's surviving. That's not thriving. Thriving is a voracious appetite, lots of energy, lots of activity, high, high life force.
Well said.
Did that answer the question?
Yes. So yeah, if cats are also picky, it's most likely something wrong other than just they're just picky.
Oh no. And think about what we've done to these cats and their lifestyle. In the wild, they would have to run down and hunt and really expend a lot of high intensity energy. In our houses, how many people have active cats? They go up and down the stairs, maybe they walk over to the bowl, maybe they climb up to their laying positions, but they're not literally running around the house very much. My cat would occasionally get the zoomies, but it was what, 30 seconds to a minute of his day. So we're not talking that was stealth hunter there. So we've really taken these animals and taken them out of their biological environments and created a lifestyle that is not supporting their highest and best interests unless we can get a way to start recreating what they would have done in the wild, eating a balanced raw diet, or at least a meat, fat, bone, and organ meat with some of the intestinal juices for their pre and probiotics. And they would chew on sinew and cartilage and bone. And they would have this variety of things that they would have been able to ingest. And then they had some intermittent fasting, not on purpose, I'm sure, but maybe they didn't catch something that evening. And so they went a day without eating. And they had less toxins than we have now. Since World War II is when we've really bombarded our world with synthetic toxins and glyphosate. So we don't have the same world that we had 100 years ago. It's not even comparable, the level of toxicity and deficiency that we see today. So our conversation keeps coming back to the whole picture. Don't just focus on one thing that you're doing. Look at the whole lifestyle. What does that look like? And how many pieces can you positively impact? So the ebook that I give away lays out those 6 principles. And even it is overwhelming. You can just go into analysis paralysis because there's so much to think about, and oh my God, I do everything wrong. So I have people take a piece of paper and fold it in half, and then they write column A at the top of the left, column B at the top of the right. And every time you're out learning from a webcam or a podcast or a seminar, everything that you're learning about that you should be doing, but you're not doing it yet, that goes under column A. Everything that you shouldn't be doing and you still are goes under column B. And then I just encourage people to pick one thing from column A and start doing it.
Yeah.
Take one thing from column B and just stop it. After 21 days, it's usually who you are. It's not something you have to think about anymore. And now go back and pick something else. And
Yeah.
if you have 2 or 3 people in your household, have everybody do something different. And now you've gone 2 or 3 times faster than the average individual. And it's not cumbersome, it's not overwhelming, but you're making headway. You're actually accomplishing something.
Yeah, absolutely. I think the thing is with this fussiness as well, I mean, it can be behavior. There can be some behavioral links with this, like it might be anxiety or where the food bowl is or something like that. But I think we've kind of lost, even with ourselves, the activity of eating, especially with pets. So the stripping and the chewing of raw meaty bones is a real activity for cats as well as dogs. And I mean, so often people say to me, "Oh, I like picky eating. I like bits I can pick," because it's kind of like there's an activity there when you're sort of dipping into the hummus or whatever it is you might be eating. And metabolically, we do set up pathways within ourselves and we release certain hormones which support digestion when we do make an activity of eating. And it's exactly the same with our animals. So it can
Yeah.
be like not just that they're full, as in they're satiated and they've got all the nutrients that they need, but they might be like just not just sluggish with the lymphatic system, but almost sluggish behaviorally, that they just aren't used to this activity anymore. And we can set that up for them again, for sure. We can help them through that.
Yeah.
Yeah. I
Or
think
cats. I'm sorry, go ahead.
Yeah, no, I was just gonna say, actually, the thing I see in practice is a bit funny because mostly the ones that are fed fresh or raw food, there I've never heard anyone say, no, they
Yeah,
have such bad appetite.
not so
It's
much.
always the ones fed kibble, and it makes sense if you think about it. It's like for
Yeah.
myself. I've tried a variety of different diets in my life, and I wasn't always as healthy. And sometimes it goes up and down depending on what you have available or if you're traveling. So I also noticed like the healthier I eat, the better is my appetite. And the times where I end up eating a lot of sugar, I get like nauseous. I don't want to eat as much. I eat a lot less because everything I eat gives out a signal in my body that I'm full. You know, the sugar when
Yeah, the
you have
insulin
enough glycogen
resistance.
storage, yeah, that will send out a hormone telling you that you're full because you have all your storage is full of sugar.
Yeah.
Crazy, isn't it? Yeah.
One of the
Yeah.
things that we do for our kitty parents is we teach them to do hunting activity before we feed them. For the exact reasons as you said, is it starts to stimulate the release of their hormones that create that hunger. And so they eat better and then there's more satiety there. And
Mm.
so that could be taking a fishing pole with a little toy on the end and you wiggle it so that they have to find it and pounce on it. And for the dogs, we hide their food. Now you want to remember where you put it because you definitely don't want to leave raw meatballs under your couch. But once the animal gets used to either playing and hunting, we did nose work with our dog, so they have to figure out using some mental activity where is the food or where is their toy. And then that also, because of that prey behavior, that also stimulates gastric juices and helps them to start preparing for food to come down the hatch. They
Mm.
don't have amylase in their saliva, so they really weren't designed to eat carbohydrates as a primary eater. They don't chew their food into pancake batter like we're supposed to. They're going to tear, gulp, and swallow. So it's the hunting activity, the prey and stalking and pouncing behaviors, that kind of game that will really help them eat a better meal and have better digestion.
Mhm.
Yeah, that's a very good point. And actually funny because I've been doing this big challenge as well, trying to transition my cat or my mom's kibble-fed cat to raw. And I was
Oh,
talking to
wow.
Amaya, which is a cat specialist in nutrition as well. And I asked, what can I do? And she said, no, you have to play with her. You have to like increase her instinct, make her work for it. And then her appetite will, get a
Yeah,
bit better. And I noticed she eats usually easier if she gets to play a bit first. So that's a good
yeah,
tip for anyone trying to make that transition with cats because it can be
yeah,
tricky.
Really hard. I find you have to go in stages. So you'd have to go kibble to wet food and then wet food to raw. It's very hard to jump, actually. But also sometimes if you just stick a bowl of whatever the new food is down, or just a couple of spoonfuls of it, with no expectation they're going to eat it, and the expectation is you're going to throw it away, but over a period of few days they will actually in the end start, oh, what is this thing that keeps appearing, and they will sort of get used to it and get used to the smell and the energy of it, and then in the end they do normally go across. But we just sort of put it down and without the other food, and
Yeah.
actually you need to put both down, I would say.
Yeah, I think it's also when they grow up with this, they learn this is what food looks like. And if you have someone who eat kibble their whole life, and then it's like they get something completely different, different texture, different flavor, different smell, they're like, what is this? That's not food. So that's
Yeah.
yeah,
why, sometimes kibble fed, especially cats, have a hard time going on to raw. And then even it's funny because like my partner's mom's dog, it's raw fed and they try to give him like a Bravecto or something, like a kibble or something, like a treat, and he's like, "What is that? No, thank you."
That's not food. Yeah, yeah.
Yeah,
yeah.
they don't see it as food.
Well, cats in particular are creatures of addiction and habit. And these food companies have laced these kibbles with things that really make the cats addicted to texture and taste. So I think one of the first things that we have helped our pet parents do is quit feeding free choice. Because, with kibble, it's very convenient. You fill the bowl and you walk away. You don't have to think about it anymore. But they get used to grazing, and that's not how they were biologically designed to eat. They
Mm.
were used to eating at dawn and at dusk. And when they have food all the time, that's another thing that creates this poor gastric digestion. So the first thing we have our kitty parents do before we try to change anything is feed them twice a day and just get them used to only eating twice a day. And then we'll take freeze dried because you can leave it out and we'll leave that in the bowl all the time. And the cats walk by, they go, I don't know what that is. And they walk away. And that might go on for a period of time. But like you guys said, eventually they're going to go back and they're going to go, oh, well, maybe I'll smell it or I'll taste it. And then once they eat it, you are home free because then they're going to start developing that palate for it. But keeping their feeding restriction down to twice a day and then not giving them treats in between. It's just like kids, right? If we snack all day long, we're not all that hungry for dinner. It's the same principle. They need to be in the wild, they need to be hungry enough to go out and spend all that energy to hunt and chase it down and wrestle with it and kill it. So we need to recreate as many natural behaviors as we possibly can in order for them to have as normal of a behavior as possible.
Actually, just realized we're out of time.
No, well, are we? Are we? That's always the question. I'm happy to do another one. Marlene was last time. That was
I
the
am
best thing.
yours anytime you want me.
Yeah,
I
I
love
think
being
we
with
do
you
another
guys.
one. Do you want to
Okay,
do another one?
I have to go though. I have so much to do. So.
Oh, quickly tell us what a couple of the questions so that we can answer them.
Okay, they're long ones though.
Oh, was there not one about pause?
Um, yes. Okay, I'll send you a couple on Instagram.
Just tell me the name of the lady, because I
Uh,
won't look at my phone.
there is a lot of questions.
No, just the lady, and because I can remember the pause, and then what was the lady's name with the red pause?
There was one from Claudia about anxiety.
And there was one from a lady, quite a quick
While
one.
you're getting that, give me 1 second. I have to, I've got a repair person in the garage. Hold on 1 second.
The
We
lady
were
who
just
asked
getting.
about the paw chewing. We will do something more. You see, we want to help you all, and Tina's got to go because her kitty has had a lump removed. You may have seen that it had the
Yes, I can show you.
shame on.
It was actually really hard because I wanted to remove it myself, and it's really hard to cut in your own animal. Like I was so nervous. I had nightmares for like 3 nights in a row. Uh, but she's here now sleeping. She's feeling very sorry for herself with her collar on, of course.
She's a sweetie. What's her name?
Lucy.
Oh, Lucy.
But why don't we invite Dr. Marlene back for later, and then we can have more questions then?
I think yeah, okay. All right, guys. Well, we will answer the Claudia's question about anxiety and the lady who asked about the paw chewing with the red between the toes. I'm pretty sure there was a lady who asked about that. We will definitely do that next time.
I'm back.
Yeah.
All right.
Okay.
Air conditioner go out, and the guy's been in the garage this whole time, and he wasn't supposed to be here till 2 o'clock, and he came an hour early. So, oh, we're all good.
We were just saying that we'll stop going live now. Thank you for your questions today, and thank you for watching. And we're keeping it real here. We've just been giving the lowdown on Tina's cat. So anyway, Tina's cat will hopefully be much better next week, and we'll give you an update. And we'll see you all then. Okay, bye for now.
Bye.